Hello and welcome to this presentation today. My name's Hannah Patterson and I'm the Associate Education Manager for Ostomy Care at Coloplast. Today we're going to be looking at how bodies change over time and the impact that can have on you and your stoma. So everybody is different. There are more than 648 combinations of bags and supporting products that Coloplast provide. And what that gives us is the flexibility to find the right solution for you. So my first question really to all of you there is, has the shape of your body changed? So why do our bodies change over time? That can be for various reasons. It could be immediately post-surgery changes. So we get that initial swelling and healing phase post-surgery. A lot of people's abdomens are quite swollen post-surgery. And then you get that almost like a deflating, I suppose, over time where your abdomen can go down and become a little bit softer. Weight fluctuations, now that can include gain and loss. So people can gain weight and lose weight in those early stages post-surgery. Especially if you've been very poorly before surgery, you can gain weight as you start to feel better. And equally, if your surgery's been emergency and you've been very unwell post-surgery, you can lose weight too. Muscle and skin changes over time. This is part of the natural aging process. Skin loses its elasticity and muscles can weaken over time. You can get hernias or prolapses. There's pregnancy, and then even our lifestyle factors. So this can be a physical activity that we do. So what complications can arise from these changes? Our stoma can change in shape and size. We can get the dreaded word leakage, which then can lead to sore skin. You can end up changing your pouch more often, and the pouch doesn't seem to be sticking so well. At this point, I will say regularly checking the size and shape of your stoma is really, really important. And when it comes to defining body shapes, we tend to look at three types of shape. So we have our regular shape, our inward shape, and then our outward or curved shape. Now we're going to look into these three body profiles, as we sometimes refer to them, a little bit more in depth. So what we refer to as regular. So what we're wanting to look at is the area around your stoma flat and even? The area that you place your pouch adhesive is level with the rest of your abdomen. Because when we look at body profile, we're actually looking at that area directly around your stoma. We're not looking all over, we're looking at that area directly around your stoma. Inward. So does that area around your stoma have creases, dips, almost a moat-like appearance? You can see that in the picture there. The stoma almost looks like it's recessed back and there's like a little moated area around it. Or the stoma is not above the level of your abdomen. So if you were to look down, you could almost not see your stoma. Outward and curved. So again, looking around the area of your stoma, is it raised, protruding, bulging, almost looking more prominent and looks different to the other side of your abdomen? Now we're going to have a little look here at the challenges that the outward or curved body shape can cause. This can be causing a lot of problems with leakage, sore skin, because what often happens is we get that creasing to the pouch adhesive. I say, imagine like you're trying to wrap a football up in a flat piece of paper. You're always going to get creases. And then you might get that heavy or dragging sensation to the area, which can be symptoms of a peristomal hernia. But what I'm going to say at this point, curves are normal. We may not want them, we may not like them, but they are normal. And just because you have curves around your stoma, it doesn't necessarily mean you have a peristomal hernia. So what is a peristomal hernia? So this is the point where a part of your bowel comes through the abdominal muscles, creating a lump under the skin around the stoma. So rather than just the stoma coming through, we've then got that area of bowel coming up behind the stoma area, and you get that raised area on your abdomen. Once again, I am going to say it again, curves are normal. Just because you might have a bulge around your stoma doesn't mean that you have necessarily got a peristomal hernia. I've yet to meet an ostomate that does not worry about leakage. So what is leakage? Essentially, we do have two types of leakage. We have the full leakage that everybody dreads. This is where your leak has gone past the base plate or the flange and then onto your clothing or bedding. We then can have more of a partial leakage, so where the leak has not yet breached the base plate and reached the clothing, but it's still visible on the back of the base plate when you remove. Both can result in skin damage, sore skin, and although both can have a different impact on you mentally, both are still leakage. Oh, I think this is quite an interesting figure here. So you can see there's 4 different backs of a base plate there. So what I want you to imagine is you've removed your stoma bag and you're looking at the base plate. So 4 different base plates there. All 4 of those are types of leakage. But that top left one, 81% of people with a stoma do not consider that being leakage. But leakage under the base plate, close to the stoma, and leakage outside the base plate is still considered leakage. And leakage is not something we should accept as ostomates, and it's something that you should not be seeing. However small amount there is behind that base plate, you should not be seeing it. And if you are, you need to be either speaking to your delivery company, somebody like Charter, or to your Stoma Care nurse. So what can cause leakage? There can be so many different causes of leakage, and these are just a few of them. Pancaking or ballooning. So pancaking, especially common with colostomies, is when your output is very thick, it sticks towards the top of your bag, it's not dropping down into your bag, and you get that literally a pancaking effect where it's just sitting there and the bag gets pushed off. Ballooning is almost what it says on the tin, the bag overinflates. So this can be if your filter has become blocked on your bag, or if the filter has become wet, or just sometimes excess wind, where your bag is blowing up, and we've probably all seen it as ostomates, where your bag is almost pushing off your side. Diet, and this can even include things as your meal times. Some people can be very sensitive as and when they eat their food, as well as the types of food they are eating. As we already discussed earlier, changes to your body, changes to your stoma size or template, poor pouch emptying or changing routine, and then overnight leaks, which can be caused by not emptying the bag overnight. And at this point, I'd like to introduce you to my very special guests. I'm joined by Jess, Yvette and Alana. So, hi Jess.
Hi, I'm Jess. I've had an ileostomy since 2021, secondary to Crohn's disease and then rectal cancer. It's now a permanent ileostomy that I've got as well.
Thanks, Jess. And Yvette.
Hi, I'm Yvette. I'm a Coloplast ambassador and I have an ileostomy since 2013 due to ulcerative colitis. I had a subtotal colectomy, so I'm still waiting for my rectum to be removed.
Thanks, Yvette. And last but not least, Alana.
Hi, my name's Alana and I'm part of the clinical solutions team here at Coloplast.
Thank you so much for joining me, guys. Now, I know you just heard the presentation there. The first thing I want to talk about is really body changes. Any experiences, obviously, that Jess, Yvette, that you've had with your bodies changing over time. And then, Lana, I want to talk to you more about any experiences you've had with talking to patients. So, Jess, I'm sure you won't mind me saying, you're recently a mum.
I am, yes, a new mum. Little boy's 17 months old now.
Oh.
So, yes.
So your body experienced a big change over time, didn't it?
Absolutely, yes. I had a huge weight gain during pregnancy. I put on 20 kilos, or over 20 kilos actually. So, yes, it's quite a huge change, and to see that and then that impact that it has on your stoma is quite big. So
what changes did you notice at that point?
I think for me, it was the fact, obviously, as your bump grows, my stoma started to stick out a little bit more. And then I found that the kind of soft convex bag that I currently use just wasn't fitting anymore, as obviously my body went from being kind of inwards. I had a temporary stoma previously, so I've kind of got a long history of swapping bags and going from flat bags when I had my temporary stoma to then when they resited my stoma for my permanent stoma, they put it in actually, they didn't resite it, they put it in the old stoma site, but it then meant there was so much scar tissue there that I went on to a soft convex bag because I did have that sort of, as you described, a moat earlier, That's exactly what it was, that moat. And then when I was pregnant, I'd gone from having this sort of moat around my stoma to everything sticking out and needing to go onto a concave bag instead. So it was a really big change.
So you kind of hear what I was saying there about the moated and then that trying to, no disrespect to baby bump, but trying to wrap a football in a flat piece of paper.
And it was a large football, as I say, 22 kilos. So.
A 22 kilo football, that is a mighty football.
It really was, yeah.
And then, obviously, those 20 kilos have now gone. So what was the impact of you post-pregnancy.
Yeah, absolutely. I mean, I had, unfortunately, a really difficult birth as well, which then afterwards resulted in my stoma prolapsing a little bit. So then I gradually went back to that convex bag, but instead of going onto a soft convex, I needed a slightly deeper one at the beginning to kind of support the stoma. And now I've gone back to my usual bag. So I've kind of been full circle, really, from flat
You've tried everything,
to
haven't you?
soft, convex to concave, back to deep concave, and now back to nice soft concave.
Yeah, so you've tried everything, haven't you?
I have, yes. Yeah.
And how about yourself, Yvette? Have you had any experiences with your body changing over time? Because obviously you've had your stoma quite a while now.
Yeah, I've had my stoma since 2013. So when I first had my stoma, I was really, really poorly. I'd been really, really poorly up to the point of surgery. Mine was emergency surgery. So I weighed 5 stone 5 when I had my surgery. So I wasn't a healthy weight. And then gradually over the years, it took me a long time to sort of like recover and then start gaining good nutrition, really, and then slowly putting back on that weight. So it was a good sort of 2-3 years afterwards. And then slowly I was finding that things weren't lasting as long, the pouch wasn't lasting as long. And then over the years, as I've become a more healthier weight, I've had to adjust my routine depending on how much weight I did put on.
Yeah, so you had to make those adaptations over time. So it was like we said at the very, very start, it's that a lot of people, especially with IBD, you often go into that operation so poorly and you do inevitably then put on that little bit of weight moving forward because you're, as you said, a very unhealthy weight at the point of surgery. And then did you have to change any products or routines at that point? I know you mentioned routine, but how about product?
Product I had to change. I had to add in things like paste, perhaps maybe changing my bag more often. But since I added the paste in, that got me back to, not changing the bag as often as I used to need to when those changes were happening.
And again, it shows that it's not necessarily just change of base, but sometimes it can be adding a necessary supporting product as well. So that's a really good point that you make there as well, Yvette. Now, Alana, I'm going to ask you, because obviously you have spoken to many patients on the phone over the years. Sorry, I'm making you sound really old there. Sorry.
That's okay.
And so what sort of questions do you get people asking when they're on the phone? What sort of concerns? I suppose, what's your trigger point to think, oh, this could be somebody whose body's changed?
Of course. So obviously the most common issue we do get is leakage, unfortunately. For us, it's really to dig deep and understand the body profile. And obviously we have questions that we really sort of dig into to understand the root cause of the issue. And for us, it's questions to also, obviously our ears are our eyes, really. So it's quite hard when you're not face to face. So it's really sort of thinking about, okay, what's the best way to describe a question? Because again, I could ask a question, but the ostomate might not understand. So it's sort of have a feel over your stoma. How does your spout sort of stick out? Do you feel your stoma through your bag? It's sort of looking down at your tummy where your stoma is located. Now, does that area there seem quite flat? Is it slightly rounded? Is there any obvious bulges or anything like that? So it's really, for us to dig as deep as we can over the phone to really understand the issue. But more importantly, when we do uncover any issues, just to point them in the right direction, whether that may be a solution with a product, but more importantly, making sure that they have the support from the HCP.
Yeah, really good that you said there about, and I think that's something we always need to remember is HCPs are always going to be there for people, but I think what you guys managed to do is absolutely remarkable. Like you say, your ears are your eyes. I nearly said it the wrong way around then. Yeah, your ears are your eyes. And it's those questions that it's not necessarily that concern that somebody's coming. I say the primary concern being leaks, but actually it could potentially be it's a change in body profile.
Exactly.
Both of you two have experienced that's actually causing those leaks.
Yeah.
And I didn't say earlier, but I know that Yvette and Jess know this, that I used to have a stoma myself, and it was one of those things that you tend to think that once you're given that product, that's your product then for life. That's the product that you're going to be on. But, of course, why wouldn't things change? If your waist size changes, you don't try and stick on the same pair of trousers, do you? So why are you going to try and stick on the same stoma bag when your waistline changes and things like that? Now, Alana said the dreaded L word there, leaks. This is where we're going to come to now. I always say that I've yet to meet an ostomate that doesn't worry in some way, shape or form about leaks. Even if you are in a very good routine, it's something that can always be at the back of your mind, I think. So coming back to you, Jess, how's your opinion on leaks? How's been your experiences with leaks?
Yes, I mean, I really struggled. I think what you and Alana have both said about the changing of the products and actually speaking to members of the team when you need that support is so important. I think for me, I had my temporary stoma for 18 months and I used a flat bag and I had very few leaks. I think I've had 3 leaks in 18 months. I had no issues whatsoever. And then when I got told I needed a permanent stoma, which was a good 10, 12 years later, I thought, well, you know, I know how to deal with this because I've had a temporary stoma. And then the first week that I had my stoma, after I was discharged from hospital, the bags just leaked constantly to the extent that I had 8 leaks in 24 hours.
Oh, goodness.
And it was all over me. And I just remember thinking, I can't live like this. And I was so disheartened. And unfortunately, I didn't have a very sort of supportive stoma nurse. I think they were very, very swamped at the time. They weren't particularly supportive in my local community. And I was just at a complete loose end. And I thought, I've had a stoma before, but
what's happening
different?
now? What's
going on?
changed? Yeah.
And I didn't know about different types of bags and anything. And I actually rang Coloplast and spoke to some of Alana's team who were just so good at being able to do and ask really specific questions. Like you mentioned, the moat was one thing, and is your stoma sticking out? And obviously it turned out that my new stoma was sited in the same place as my old stoma. There was so much scar tissue there that there really was. It was really indented.
Almost pulled back a little bit,
back, yeah. Although it wasn't, I could still see it from when I looked down at my abdomen. There was a lot of indentation there, and there was no way a flat bag was going to stick to a heavily scar tissued abdomen, really was the bottom line. And it was because of the clinical solutions team that they mentioned they had these soft convex bags, and you know, I was able to then try some samples, and it suddenly went from me thinking, this is it, my life's over, I can't leave the
do
house.
this.
I can't carry on like this, to suddenly just going out and doing everything as I was doing before surgery. And it made such a difference to my recovery. So, sorry, I think that's quite a long one, but it's so important.
What I love the point you make there is, and I said, you think that is your one product.
Absolutely.
And it's that old adage, is it? You don't know what you don't know.
Yeah.
And I think most ostomates go in there thinking there is one type of bag, there's that flat bag, and that's it.
And they think they have to live with that and continue with that. And that's just normal to have all these leaks. And I think that's what's so important about us chatting today, really, isn't it? That leaks aren't normal. And actually, there's so many solutions. That mentioned the pace, that's not something that I've ever tried, but that's something that obviously has made a big difference for you. That there's so many different solutions and everyone's different, and getting that support is so important, isn't it?
And I think it's realising what is leakage as well, because as we saw from that graphic earlier, people don't consider that little bit just around the base plate to be leakage. 81% of patients don't consider that to be leakage. So it's actually making sure that it is very clear that it doesn't have to be all over your clothes to be classed as leakage. It doesn't have to get to that catastrophic point, because I think probably the 3 of us have been there where we've had those leaks where it's gone onto your clothes, and I'm not even being where you feel like your world has ended at that point. You feel like you don't want to leave the house at that point. And I always tell a story, and I'm going to shamefully tell it again now, where I was in bed overnight. I got ballooning because my filter had got wet. I woke up. It was everywhere. The mattress had to get thrown away. It was all over the bedding. But also, during the whole drama, the cat jumped on the bed and was sick as well. So it was double drama. Well, actually, I suppose it was almost triple drama at this point. My poor partner at the time didn't know who to clean up first, whether it was the bed, the cat or me. I can obviously laugh at it now, but at that time, I was lying in bed, feeling like I couldn't move, just sobbing my heart out. Yeah. And you feel that everything is against you at that point. And I can't even imagine for you, just you saying that 8 in 24 hours. I mean, oh.
And I think it's hard because for me, I knew that wasn't normal because I'd had a temporary stoma, but I did really feel for anyone that would have been in a similar situation who hadn't had a stoma before, who was then told, they needed emergency surgery, they had to have a stoma, that was it. And then they think, that's it, my life's over, because I can't leave the house because I'm just leaking constantly. So it's really, really challenging if you experience that.
And I think that's an interesting point to come to with you, because obviously your surgery, as you said, was emergency. So what was your sort of awareness around leaks? What was expected? What was your thoughts at that point?
I'd already sort of been forewarned by my surgeon, because he was kind of going through the pros and the cons, and he's like, you're not going to be living in the toilet like you were with your colitis. He says, but his words were, he says, there's going to be times when you're in the middle of Tesco and you are going to have a catastrophic leak. He says, but you'll recover, you'll get over it, you will move on. And he was absolutely right. And I have had catastrophic leaks. One, fairly recently, we were going to look round a local reservoir and something felt a bit weird and a bit off, and I thought, oh no.
Was it the itch?
It's a dreaded
It was
itch.
the itch.
It's the itch.
But it was a bubbling thing that I'd never really experienced before, and I thought, it's a bit weird, what's going on here? And there was a catastrophic leak. And of course, I wasn't prepared, didn't bring any spares or anything. Went to the toilets, stuffed it with toilet roll, tried to make do and not sort of ruin the afternoon. But in the end, I had to cut it short because it was just catastrophic. But in that instance, it was to do with my routine. We'd been going out, rushed the bag change, and I've got a really decent spout on my stoma. And I'd rushed it and caught the stoma, and he'd flipped under himself. And then, of course,
He'd done the up and over.
yeah, it leaked everywhere.
And I said that sometimes leakage sounds like it is user error sometimes. And is this sort of thing that you have to try and, how would you get that sort of information out, Alana? Because I can imagine kind of looking at body shape is a fairly easy thing, but how do you look at maybe somebody that's in a poor routine of changing?
Of course, it's quite simple, really. It's just sort of really asking, talk me through your bag changing routine, understand what they're using. And again, people use creams and things like that. They have different things that they use in their routine. So it's really good for us to understand, again, what they're using. But more importantly, have they been educated by their stoma nurse? Or again, people have had stomas for many years. So it's just re-establishing what good looks like for them. And again, maybe just taking things out. Sometimes less is more in routines as well. And just giving some advice, really, just to maybe swap some products or maybe take some things away to make sure that they've got a straightforward routine and nothing's bothering, again, the adhesive sticking down or how they're changing it or if they're applying the product correctly as well, which is really important.
I love that less is more factor. And I think there is a bit of it's like a bit of a fear of missing out. And I think within the hospital community, you see things online, you're like, oh, I think I might want that. And people tend to get a bit almost trigger happy with thinking they need all these products. And I say less is more. I'm also a firm adage, if it ain't broke, don't fix it. Mm-hmm. But people seem to want to add things in. Mm-hmm. And often then, back when I used to work as a healthcare assistant with stoma patients, often it's that deeper root cause that somebody thinks they want so, but is that actually a worry about something else? Mm-hmm. So, for example, one of the things that we see a lot is odour, that people want. But as we all know, unless you've got problems with leaks, you're not going to have a problem with odour. So it's actually those sort of inquiring questions. And again, that's something, so I'm going to come back to you, Alana, like, I'm going to switch it up a bit. What sort of inquiring questions do you use when you're looking at delving into those root causes?
I think it's more understanding where the problem is, when's it happening, how often, more importantly, diet, hydration, what they're having, what foods, again, I know you touched on that recently as well, but what they're eating, what they're maybe not eating, and again, medications and things like that. It really can affect the output and how the stoma functions as well. So there's quite a few questions we go into, but really for us in the initial sort of conversation is really understanding what the issue is, where it's happening, when it's happening, how often, and how it's really impacting you guys, how it's impacting you day to day. And then we can sort of delve in again around body profile, but more importantly about routine, whether that's bag changes, hydration, diet, medication, and products also. Really good point. I'm going to come to you again now. I'm going back in the other direction now. It's like I've done a little boomerang thing here. Looking back at leaks, what hints and tips have you potentially got for people listening out there
to help avoid leaks? Because I know that you said, I know it sounds like I'm picking on you, but your last leakage was your own fault.
Entirely my own fault.
So what would be your little hints and tips to avoid errors?
Hints and tips. Don't change your bag in a rush. Take your time, especially if you're a new ostomate. Take your time, go back to basics, start from scratch, think things over, make sure you're doing it right. But also things like food, I've noticed, things that are sort of quite highly acidic, so spicy foods, tomato-based foods, I tend to find they erode the base plate a lot quicker. So whereas normally, say, you would go maybe 3 or 4 days between a bag change, I find if I've eaten maybe a bolognese one night and then followed by a curry the next night, that actually my base plate will not last, so I need to change it more regularly. So it's paying attention to what you're doing, what you're eating, taking your time over a bag change. And even my very first leak, all those years ago, it was something so simple as using an adhesive remover wipe, and then I didn't then cleanse that off. So I stuck the bag on, went to bed, and woke up halfway through the night because it hadn't been, there was still a bit of adhesive remover left. So it's just really kind of taking your time to think things through, what you're doing, what you're eating, and just checking your routine.
I love that. Just don't rush.
Yeah, don't rush.
Take your time. How about you, Jess? Any hints and tips that you've come across over time?
Yeah, I mean, I think diet, as a vet said, is a really important one for people. Often people are scared to eat because they think, oh no, there's going to be more in my bag as a result. And actually that kind of irregular eating pattern can then result in people eating much larger meals in one go and then finding that it's a lot for the stoma to deal with. They might get a bit of pancaking as a result of that, or things like people not drinking enough. So really kind of basics, isn't it? And we're probably all a bit guilty of not drinking enough often. And then finding the output gets really, really thick as a result. So you then get some of that pancaking, which is more likely to cause some leaks. I think the other one as well is just reaching out for support. In that everyone's stoma is different, isn't it? And I think from my own experience of speaking to Alana's team, it's been so helpful to have that. And I think Alana mentioned something about creams earlier. And often it becomes a bit of a vicious cycle. I don't know if you see this, Lana, when you see people, when you speak to them, that they have leaks, the skin gets really sore, and then they think, oh, I need to put a bit of cream on it because my skin's sore, which is what you do with other wounds, isn't it? And then it becomes that cycle because the bags don't stick. There's more leaks occurring.
The tub of Sudocrem comes out.
Absolutely, yeah.
Other creams are available, but you do get people reach for the Sudocrem.
Absolutely, and you understand it because anywhere else you had a wound, you'd probably do that. And your skin is so sore and itchy when you've got a leak, doesn't it? If it's really got onto your skin, I think that's where reaching out for the support and getting the right products is so important. That speaking to Alana's team makes such a big difference because everyone is different, and we probably all experience leaks, but for slightly different reasons. Often there's some crossover, but there's also different reasons.
And I'm going to add that, and it's important of reaching out early. Don't let the problem exacerbate. Don't wait till it's got to a point where, unfortunately, where you were having to change your bag 8 times in 24 hours.
Absolutely.
The second you start to get any problems, reach out for support, be that to your HCP, your Stoma Care nurse. Reach out to Charter. Anyone that you can speak to, get that support early on, because it's always a far easier issue to deal with when it's early doors than when things are getting more exacerbated, because then the skin gets more sore and then it does become trickier. So that's one thing I would always emphasise to people: reach out for that help and advice earlier. Even if it just turns out that you are rushing a bag change and that's all that you need to do. It could just be that simple thing that somebody asks you one of those inquiring questions that Alana was talking about, and you go, oh God, I've not dried my skin properly after I've cleaned it.
In my case, my leaks got so bad that my whole of my wound around my stoma had completely dehisced. And so I ended up being readmitted to hospital for 4 days to have adequate wound care. And I suppose that is slightly my fault, really, in that I thought, okay, I've had a stoma before, I can deal with this, and I let these leaks continue. And exactly, you can manage. And then actually
it shows any stage of the journey as well, that although it was a new stoma for you, you were an experienced ostomate at that point. And it's not just about people post-surgery reaching out for this support. You could have had your stoma 10, 20, 30 years. If you're having issues, Even if, as we looked at those pictures there, even if you're getting that little bit of a leak around the base plate, you shouldn't be. Reach out and get that support before it gets worse, because leaks are never going to just improve. If you're having a leak, there's obviously when you do something, but by themselves, they're never going to just improve. There's something that needs to change to make that improvement. Another thing I'm going to add in my little hints and tips section is what I had to do initially was set an overnight alarm to check my stoma, because I'd gone from not being able to sleep when I got my well, I always say Crohn's because I've got re-diagnosed Crohn's, but at the time it was diagnosed as ulcerative colitis, because you're constantly awake because you feel like you're running to the toilet like multiple times a night. And when all of a sudden I wasn't in that pain having to rush to the toilet, I found if I wasn't careful early stages, I was sleeping through and waking up either on the verge of a leak or having leaked. So I always set for, I think it was probably for about the first 3 or 4 months until my body got into that trigger mode, I used to set just an alarm for about 2-3 o'clock. And even if it was just the tummy pat, we all know that, the seal, the little tummy pat there, just to give it a little check. And then my other hint and tip is don't ever try and change your stoma bag after you've had a bottle of wine. That didn't end well either.
I was going to say, is that first-hand experience?
Yeah, I forgot to do the bottom of the bag up, which is never going to go very far. To be fair, the actual bag was stuck on beautifully, but when you don't do the bottom up, it's pretty ineffective. So there's my other hint and tip for you all. Before we go, is there any other hints and tips regarding checking body shape or anything any of you guys want to say? I'm going to come back over to Alana.
Yeah. I would just say, recognise, have a look at the back of your base plate when it comes to changing, and have a little look to see if there is any seepage under there. I think it's important that as an ostomate, you're checking your cutting size on a regular basis, that you've got support from your local stoma nurse. But also, I encourage anyone to reach out to Coloplast and my team. They're great, and they're there just to help support you. And also, we have our own nurses as well in-house to be able to support patients with any issues that they might have. So I would just say, just regularly checking your cutting size and actually just recognising if you do have any issues at all, whether that be sore skin, leakage, ballooning, pancaking, all the things that you mentioned prior.
Really like that point of checking the back. The back of your base plate can tell 1,000 stories, I think, when you look at that back of your base plate, when you've removed it. Have a look. If you're seeing any faeces at all on there, that's a leak. No matter how much or how little, that is a leak.
And then it's normal. It's normal for that to happen. And that you're not alone. And that we're here to support you as well.
Yeah. Yvette, anything more from you?
I think just pay attention to yourself, your body, how things feel, what you're eating, what you're drinking. Just take your time. Everybody's different. So what works for maybe another ostomate might not work for you.
Yeah, really good point. It's not a one-size-fits-all.
Exactly.
As we said, it was over 600 different combinations of bags and supporting products out there. No one's going to be the same. And anything more from you, Jess?
I think what you said earlier, Hannah, about, when your trousers get too tight, you think, okay, maybe I need to try a different pair of trousers, whether I change size, up or down, whichever. And the same thing with your stoma bag. If you notice you're gaining or losing weight, does your bag need adjusting? Are you having more leaks than you were before? And just that question mark, okay, this isn't not normal. This isn't what's normal for me. So what can I change? And then reaching out for support. I think I can't really sing Alana's praises, team enough, because they're so good and they've been such a difference to me that I hope that other people can feel confident reaching out for them.
That's really lovely. And thank you all so much for joining me. It's been absolutely brilliant hearing all your stories from yourself, Jess, and from you, Yvette. And Alana, hearing the support that your team can offer, it really is invaluable. Thank you all so much. Now, don't go anywhere, because shortly we're going to a live Q&A. Hello and welcome. Apologies, first of all, we had a bit of a technical glitch at the start there. I was meant to come in and introduce myself and introduce the webinar, so apologies there. We do have the live Q&A session open in the background, so if you do have any questions, please feel free to put them to our panel here. As you can see, I'm joined by Yvette again. So hi, Yvette, thank you for joining us.
Hi.
And unfortunately, Alana and Jess couldn't make it today, but we are joined by Alex. So, Alex, you want to just briefly introduce yourself?
Yeah, so my name's Alex. Thank you for having me. I've worked in the clinical solutions team for 4 years now, especially in the Stoma Care department. So any product issues that Stoma patients have, we are here on hand basically to support you every step of the way that we can.
Thank you. Now, we have got a few questions already. This first one, Yvette, I think this is one is going to be for you and me, and it's a really good one. So when you were discharged from hospital and at home recovering, what top tip would you go back and tell yourself?
There's lots of things, but my main top tip would be to remember that Rome wasn't built in a day. You've just had major surgery, and while on the outside maybe your wound might be feeling really well healed, inside there's still a lot of healing that needs to go on. Don't forget you've had a lot of drugs pumped into you. You might still be on a lot of strong painkillers. Just because you're home doesn't mean that you are well. Rome wasn't built in a day. Take it one step at a time. And actually, when you're in hospital, it's a very well managed environment. You know, you've got somebody bringing you medication all the time. You've got somebody bringing you your meals. You don't have to worry about doing the pots. You don't have to worry necessarily about doing the laundry because people will take that home for you or whatever. So don't go jumping in to, oh, well, I'm home now, so I can do the dishwasher, I can do the pots, I can put a load of laundry on, because you will feel extremely exhausted, particularly in those early days. Just be kind to yourself. You've been through a lot.
Yeah, love that, Yvette. And I think mine would probably be along a similar vein, is actually be kind to yourself. As you said, Rome's not built in that day. You're not going to be able to go back to doing exactly what you were doing straight away. Take that time, be kind to yourself. But also, I wish I could tell myself it does get better, because those first times when you're at home and things do go a little bit awry, as naturally as human beings, we're our own worst critics. So we always take it at most personal at that point. And so actually just to say to myself, you'll be okay. It does get better. You're going to be all okay. Alex, I know that you're not able to talk from a particular self-experience, but are there any experiences that you've had of patients that have come back to you that have had any little nuggets of wisdom like that?
Yeah, we do experience patients coming back every now and again where it might be after a couple of years since they've last spoken to the team in clinical solutions, and they've had some changes in lifestyle or changes in their body. Maybe they've lost a bit of weight, started getting to the gym a bit more, and it's natural that you do need to look into a potential different bag, different products. Because you're not going to stay on that same base plate, that same bag type for the rest of your life. For some people will, and so be it. But your body will change as you get older, as you start doing things post recovery. You see that things like running, Pilates, things like that are hot in the hot topics at the moment, so your body will start to take an effect in a positive way, hopefully, but that does mean that you might need something slightly different.
Almost don't be afraid of changes. Don't be afraid that those changes could happen. Really good point. Now,
I noticed, Hannah, that fits in with the question that's just been asked, actually, about body changing.
Very good.
Do you want me to read a question, or?
Yeah, occasionally get the smallest of leakage issues that can lead to surrounding sore skin, but I've found the use of Manuka honey-infused support rings a great help for healing. So, there are lots of products out there that can help with these episodes of leakage, seepage, however you refer to it. One thing I want to say is that I'm really glad that this person addressed the fact that it was a small leakage, but they still got it addressed. So well done to this person. And lots of seals can help. We've got the Brava seals, and there are products with Manuka in and things like that. And all of those are designed to, this is why we refer to them as supporting products, because they support the pouch care routine. A lot of people might refer to them as accessories, but we're trying to lean to more of that as a supporting product, because it does support the role of the pouch there. So, yeah, I think we actually almost covered that within there as well. You're right.
There's another one very similar as well.
Gosh, they're coming thick and fast now.
The one where they say that my body has changed a bit over the last couple of months. Can you see that one?
Yeah. And I've noticed that maybe 1 in every 3 bag change shows small signs of inner leaks around the very inner edge of the base plate. What should I do? I would definitely say these are episodes of leakage, however small. And as the previous question we just addressed said, maybe it will be something like a seal, a ring, as some people prefer to do, that can just help with those small episodes. Also, checking that template is a really important factor as well. If you've had some changes to your body shape, there may well be that there has then been changes to your stoma template, increase, decrease. So take that time, just recheck your template and just double check. Alex, would be there anything you suggest from that perspective?
Yeah, always just checking the template once a month, regardless of if you've not lost or gained any weight. To get into a really good habit of checking that template, because you never know, it could change, and that even just that slight 1 millimeter, 2 millimeter change could make the world of difference, especially if you are having that leak. So, and we always advise our patients that not always is the solution in a change of products or something like that. It could be as little as just changing your cutting. You might have the right base plate, the right type of bag, but changing the cutting could fix everything. That's why we saw in the webinar earlier that sometimes less is more. You know, there might not be that necessity to have a supporting product because everything might be perfect. You just got to change that cutting. So do always make a really good habit of checking once a month. Maybe when you get a new box ordered or something like that, just give yourself a check.
Yeah, and millimeters don't sound like a lot in the general scheme of things, but with stoma measures, millimeters can make the absolute world of difference, as you say, Alex.
Yeah.
Anything from you, Yvette, on that one?
No, I'd completely agree with Alex. Is that, you know, just keep checking, and the more you check, the more you'll get used to realizing what little things might be going wrong.
Yeah. This is quite an interesting question here. Do any companies welcome feedback from users of their products? Obviously, we as Coloplast can say we welcome feedback on a regular basis. You know, we would always welcome feedback, and I'd obviously like to think that other companies would do as well, but obviously we can't speak from other companies' perspective. But I would like to think, well, hope that they would do. Alex, is this anything you're able to shed any light on at all?
Yeah, definitely. We do always welcome feedback. The mission statement for Coloplast is to make life easier for people with intimate healthcare needs, and we do actually try to set the global standard for listening and responding. And we don't. Sometimes these products, these improvements, they don't come without feedback from patients, because at the end of the day, actually, sometimes the patients do know best, you know. And I can't speak from personal experience. I don't have a stoma myself, but there's a lot of times where patients are always giving us feedback, talking about how things can be improved, what's working for them, what's not, because not, again, is always the improvement needed in a product. But actually we share best practice, you know, and we have colleagues that will be saying this might have worked for one of my patients, you know, actually try it again with a patient who might have been in a similar situation. So we always do welcome feedback, and talk to us about what's working for you, what's not, and if we can act on it.
Yeah, great. And are there any experiences with you having given any feedback?
Yes, when I first started using the Sensora Mio bags, I gave some feedback, and it was definitely taken on board.
Brilliant. The next one is, I suffer from smelly urine. Is there any stoma products that can help your ostomies with this? And the other question, this is a good, when will black urostomy bags be available, or is there an update on this? So from the point of view of black urostomy bags, there are new products coming out in the black pouch range all the time. Do keep an eye out. We have to roll them out gradually so that we can make as much available as possible sooner, because if we tried to bring everything out all in one go, it would take years before anything could come out. But just keep an eye out on socials, keep an eye out on the website. There are more updates coming on a regular basis. Then regarding the urine, unfortunately, urostomy urine does have a particular odour to it. But what I would say is, if it's anything more untoward or unusual, if you're noticing any stronger smells than normal, that can be down to a multitude of reasons. Dehydration is one major aspect that can cause that. And also the food that you're eating can cause this as well. And obviously there can be infection risks as well. But I would always suggest, if you're noticing a more foul odour than normal from your urine, speak to your stoma nurse. Anything from you there, Yvette, on that aspect? I know obviously not really, but literally your bag.
You literally took all the words out of my mouth. I was going to just making sure you were hydrated, foods, and double checking that there is no infection going on there. Because
although I've had an ileostomy and Yvette, you've got an ileostomy, I think we can both agree that there are changes in smells there if you have got infections or you're dehydrated. I used to notice very different smells within that aspect as well. So that can be, and I'd say even the foods that you're eating as well. So maybe look at often foods like fish can cause quite strong odors, things like that. And so just maybe look at what you're eating and drinking, and hydration as well. Check that color of your urine. And then also looking at infection as well, and maybe look at getting those samples taken. Alex, anything from you?
Not much else, no. But I think it's kind of across the board, really. Even with those with the fecal stoma, do listen to your body, and if something is not right, there's something not right with your output, whether it is urine or whether it is feces. Do get in touch with a stoma care nurse, especially if it's not normal.
Yeah. And it is just that being aware that anything that's not normal, any changes to the normal, need addressing. Another question here, very similar to the last one. What is the future of urostomy products? It seems as though the evolution of them are a lot behind other stomas. When will new colours, inspection windows, etc. come out? Hopefully I've answered that question with the previous one, that there are always upgrades, new colours coming out within the product range. So do just keep that eye out. Alex, I'm going to probably ask you a question here that have you been asked this quite a few times?
Yeah. I still remember when I joined Coloplast back in 2019, and I still remember. So we're sticking with grey, with grey, always grey, and then the first Mio and black came, and it was amazing. Just reassure us it will come at some point. It's just a very long process. But yeah, it's very highly requested, even for urostomy patients. I suppose we can only apologise that it does feel like you're always last at times. But yeah, keep an eye on the socials and the newsletters, because it will come at some point, hopefully.
Yeah, and that's all we can, is because it. And I say it is unfortunate. I completely feel for the urostomies that they do feel like that. But it's not the case. So it's just having to roll those out gradually to get it out to as many people as possible. Things are coming. Things are happening. We do think of urostomates, and you're just as important to us. Now I'm going to come to Yvette. Seems to be my chief question spotter. Is there any questions I've missed, Yvette?
No, I don't think so. No, I think we've got them. I can't see any more new ones that have popped up.
No, so I think that if any questions are posted afterwards, we will still be able to answer them. I can still put them to our panel here. But other than that, I want to thank everyone that's joined us today, whether you've been watching live or watching on capture. And we look forward to seeing you again on another webinar soon. Thank you very much.